I want to highlight one thing. With the exception of maybe one person on the panel, when we trained in medical oncology, there was no BRCA testing, there was no identified gene, there was only the potential in families for this to exist. And BCRF-funded investigators and others actually had a kind of a foot race in the 1990s to get to the gene. They knew the side of the country it was on, then they knew the state it was in, and then they knew the city. I'm using a euphemism for the chromosomes, and they were drilling down to get to the spot. It turned out to be a very complex gene, which we can talk about. So we don't want to get too esoteric, so let's go down the panel first and just talk about the idea of testing as a good idea. Is knowledge power high? What do you think?
Well, I think in general for everybody, it's a tough decision. I think a lot has to depend on the family history of the patient, and also that depends on the pedigree. I mean, if you're an only child and your mother was an only child, sometimes the family history isn't that helpful. But I think the context is very important in the decision, and it does pay occasionally to do this in patients with a diagnosis, because it may have implications for other care, such as consideration of prophylactic mastectomy or oophorectomy. So I think a lot has to do with the entire history, and then a lot has to do with the patient's perceptions of how they'll use the data. Because sometimes with wisdom there is sorrow, and you find out you have this gene and maybe you didn't want to know that. And of course it's not just you, it's your entire family, maybe your sister who you haven't talked with in 2 years. So I think other than the medical part, there's a lot of social and perhaps spiritual factors coming in here. But I think for everybody to have this just after they're diagnosed probably isn't the best strategy at this time.
So Nancy, what do you think about this?
Well,
I know you guys have an algorithm, right?
Yeah, well, it's always hard to follow Hy. I agree with everything that he said. I think that the decision in terms of testing is both a decision as far as yes or no, but also a decision in terms of when. And so that, I think the decision yes or no is something that Hy addressed, and the decision of when is somewhat more complex, and that depends a little bit on whether the immediate treatment would vary or depend upon the results of the testing. Fortunately or unfortunately, at this point in time, our recommendations for chemotherapy really don't depend to a great extent on the results of BRCA1 or BRCA2 testing. And the effectiveness of chemotherapy, as best as we can determine, does not seem to overly depend upon the result of BRCA1 or 2 testing. What can obviously make the difference is, for example, if a woman is diagnosed with a lump and is trying to make a decision between a lumpectomy or a mastectomy, and has a strong family history and would prefer to do everything in one surgery, that might be a situation where it is important or would be helpful to get all of that information as quickly as possible. All of this, of course, and Nadine can speak to this, is that the testing does take time, so anywhere between 4 and 8 weeks. So this is not something that is an immediate test.
Well, I agree with everything that Hy and Nancy has said. Let me see what I can underscore.
We're such an agreeable bunch.
I think I'll try to expand the topic a little bit, because we're entering an era now where there's advertisement to swap your cheek and find out what you're at risk for, what cancers you're at risk for, Alzheimer's, heart disease. So I think I can make a few points that are general and try to answer your question. I agree that the most important thing is to try to find out to consider testing if you're going to do something with the information. And that would lead me to maybe the most important point, which is that in making a decision whether to test, I think that everybody should be seen by a genetic counselor. I feel strongly about that. I think we're entering an era now where primary care physicians and gynecologists are offering the testing. The result comes back, and people didn't really know what that was going to bring with it, all the emotional, psychological. So I think seeing a genetic counselor to consider genetic testing doesn't mean you're going to do genetic testing. It just means you're going to become educated and informed about what you might do differently, whether it's the type of surgery or preventing ovarian cancer by removing ovaries, or in young people considering very, very new therapies like pre-implantation genetic testing, in which somebody can choose an embryo that doesn't have the mutation if they're thinking of having children and they have the gene. There's a whole spectrum. But I think the point is to educate yourself about what you would do differently and then make the decision. So there are guidelines about for whom it is appropriate, but I think the counseling is the most important.